All right, guys. Well, it's just a few minutes after 4, so welcome back to another seminar for the Y Seniors Virtual Connect. Today's topic is breast health and breast thermography. Our host today is Gay Walden, and Gay is a holistic health coach and a medical thermographer. And I personally have just recently been doing this experience. So as in this whole experience with doing these weekly things, I've been learning a lot myself. Had more time to focus on my wellness since COVID has started. So I've been trying to do some things, investigating a little bit deeper into my own wellness journey, and it's been interesting. This experience was sort of prompted by a callback from a mammogram that I had, which was turned out to be, nothing that they said I needed to be concerned about. But of course, I was a little concerned about the callback. And I know these days, even when you get those callbacks during COVID and things are like that, it makes things even scarier because there's some time elements, and just getting called back anywhere into a doctor's office is not always an ideal situation when you're nervous about leaving the house. So anyway, it sort of led me to this experience to take personally. And anytime I have a personal experience that I find very positive, I want to share it. So here I am sharing this with you, and we're going to go ahead and get started. I can still admit people as we go. I see a few more people coming in, but I'm really happy to have Gay Walden here. So Gay, welcome.
Thank you, Jane.
Over to you, and tell us a little bit about yourself and what you do.
All right. Well, thank you for that introduction. Yes, I became a health coach before I learned breast thermography. I was trained by a doctor who's a pioneer in this in the Gaithersburg, Maryland area. His name is Dr. Bruce Rind, R-I-N-D. And my daughter was his medical assistant, and that's how I got connected with Dr. Rind, and was led to have this specialty. When I became a health coach, by going through the Institute for Integrated Nutrition's health coaching certification program, I knew I needed a specialty, and I wanted to work in women's health. And because my daughter was his medical assistant and needed someone to do thermography in his office in DC, I was very fortunate to be able to go up there and train under him. I opened Holistic Breast Health, offering thermography to women in our area in 2012. So my business is 8 years old. People from all around do come, but mostly the Charlotte area, but I have people from all over North Carolina because there are very few people who do what I do. And not to say there are not other people in our community who have cameras, thermal cameras doing this, but everyone does it a little bit differently because it's not regulated. It's not a regulated industry where you have to, you have to do things a certain way. So that can be good and bad. But as I mentioned to Carolyn prior to our getting started on this, it's a risk assessment screening. The best way to describe thermography is this way, like a forecast. And this is the way Dr. Wren describes it. Weather forecasts we cannot reverse. If the skies are becoming cloudy and a storm is imminent, there's no way to reverse that. But if you get a risk assessment, i.e. a forecast with the breast thermogram that's headed in the wrong direction, if you've done the screening in time, you have time to reverse that forecast and bring it back to sunny skies, which means reducing your risk. And that's the way I train to do this, and this is the way that I do promote it. Now, I don't know how many of you were on Effie Sperlin's presentation a couple of weeks ago. Effie Sperlin is, okay, good, Pinky. Joanna, were you? Oh, good. Because, Jane was just asking me who started what. Effie and I have separate businesses, but we definitely are partnered together in helping women with their breast health. Normally, a woman comes here for a breast thermogram, and the first thing when I start counseling her about things she can do to improve her breast health is say, you must learn how to do a breast lymphatic massage. In the massage field, it's called breast lymphatic drainage. That's what Effie's specialty is in breast health. So most women who come to me, I definitely do recommend that they go to her because she can be hands-on. You can learn how to do a breast massage by looking at a diagram. And as a matter of fact, on my website, holisticbreasthealth.com or .org, either one, I've got both domains, you will see a diagram of how to do a breast lymphatic massage. But with someone working with you, I think it's better to really learn to do it well and properly. And she can guide women to know how to do this. And when they make it a habit, I have seen over and over again the improvement that women have in their breast health. So it's one of the top lifestyle things that a woman can do to affect positive change. But today, during my presentation, I'm going to introduce you to some other things that women can do to affect positive change. And I'm going to show you before and after images of women who have actually made improvement. And this is a picture is worth 1,000 words. Now, breast thermography was registered with the FDA in 1982 as an adjunct. That means in addition to the other screenings. That's how it was registered. The FDA obviously has not promoted it, but it is legal. It is registered as an adjunct. And anyone who says this replaces another screening is misleading you, and they won't be in business for very long by promoting it that way. In an ideal world, every radiologist would include it with the other screenings because it gives a part of the picture that the others do not. And I'm even going into this in my presentation, how they all differ. But let's go first to the present. You see the slides? Okay, come on. It's not moving. Uh-oh. My slide presentation. Okay. Here we go. I got it to, okay, now it is. You see that? You see this image, this rainbow or false color image? Okay. This is the first image I'm showing you, and I want you to understand that we look at the images in two ways. In color, which is called the false color image or rainbow, all the colors of the rainbow. And by looking at these images in color, we're able to map the different temperatures that I pick up with the camera. I use a very sophisticated thermal camera, and they're very sophisticated nowadays. They can map temperature differences like mine to 1/10 of a degree. So what I'm doing when I'm taking a picture of your breast, and that literally is what I'm doing as a thermographer, I am taking a picture of the temperatures on your breast, because this is a surface test, and it's used to pick up heat. So what does heat tell us? Well, any of the warmer areas can indicate infection, trauma, and if it's not infection or trauma, it's inflammation. And inflammation is something we can reduce in the body. By taking the appropriate action steps, we can definitely reduce inflammation. Inflammation is what causes disease. In this particular first image I'm showing you, you will see the color scale on the right-hand side. And this is very easy to understand. The cooler colors are light blue down to black on the scale. The warmer colors are dark green up to white. Okay, so obviously we want to see coolness. The coolness represents healthier breast. Now, whenever we do see a slight difference, I've been taught, and the way I've been taught to do this, we actually even measure the areas. You will see, and when you're looking at these images, the right breast is on our left, and our left breast is on our right when we look at the images, because the woman, when she does the screening with me, she's facing me. So let's look at the right breast, which we will see on our left-hand side, and you'll see there's a circle above it because there's a green area. Look at that same area in the left breast. That area is in blue and some dark blue. So we know there's a temperature difference, and we're measuring that. And above, you'll see the average and the max temperatures. And if it reaches over a certain amount of difference, like over 1.5, it brings attention to that right breast, but we can already see in the color that there's some difference between the right and the left breast. The right is warmer around the nipple area. Another way we look at these images is what we call grayscale. And the reason why we look at them in black and white, please look at these dark veins, and that's what these are. They're veins that show up dark in the grayscale. That means the blood in the vein is warmer and it shows up dark, and that's indicative of heat again. You will see when you look at that left breast that I have pink markings here. And I wanted to bring that to your attention because what we see there is something we call thermovascularity. And that means when one of these dark veins starts to branch off, that's called thermovascular branching. And every woman I image has a certain amount of that. And that can be, most of the time, that's an average risk rating when we see this branching above the breast tissue. Now, when that branching proceeds into the global breast, like this particular image, you will see that the pink that I've marked, the pink marking goes down towards the nipple. We really watch how these vessels are forming, because there's something in the body that can take place that we're trying to avoid called angiogenesis. It's the formation of blood vessels around something to feed it. And obviously we don't want to see anything in these grayscale images indicative that this process has begun or is taking place. So this thermovascularity is part of the assessment, meaning if we see more of it than we would like to see, it adds increased risk to that breast or to the breast. Now, it's important that the breasts look alike from a color standpoint. I'm showing you this image. This is a risk rating, and the risk rating scale is TH1 through TH5. We use a scale. This is a TH1, and it's one of a kind. I've done so many of these, and it's rare, very rare, that I see anything like this where the breasts look exactly alike. This is very, very unusual. It's good. You don't even see above the breast any differences in the color patterns at all. If I were to turn this into grayscale, you would not see any thermovascularity, which is very, very rare. So it's important that they look alike from a color standpoint, because everything is healthy when we do see an image like this. I will be showing this image later on in a before and after, and I'll tell you how this woman got to have an image that good. And it has to do with something in lifestyle that she did that affected this kind of change. She had a good thermogram in the beginning, but this is incredible. And every time I look at it, I don't even think it's real. But I show women this image to let them visualize what we want the breast to look like. Okay, this is total asymmetry. You can see how different this image is from the prior one I just showed you. The breasts from a color standpoint do not look alike. And I will tell you about this woman. I imaged her very early on after I got my camera. I was doing a friends and family special. I wanted to acquaint as many people as possible with this and use the camera. So this was a lady that had just had a mammogram, and she had a normal mammogram, but she has a history of breast cancer. So she had been getting mammograms every 6 months, because normally after a breast cancer diagnosis, they recommend more frequent mammograms. So she had had a normal mammogram, and I imaged her, and this is a high risk thermogram. Not only because there's asymmetry, but you can see in that left breast, towards the inner quadrant of that breast, there's a warm area there. Well, obviously that inflammation was, they can't pick it up in a mammogram. So she had a normal mammogram, because it takes a while before a centimeter sized lump can show up in a mammogram. Years, 8 to 10 years is what they say. So I'm always hopeful when I image women that I'm getting these women in to see me in time to just pick up this inflammation and reverse it. So the process of this inflammation continuing and irritating the tissue to perhaps form a structure doesn't happen. So what does this mean for this woman? A normal mammogram and a high risk thermogram. What it means is, if she doesn't make some lifestyle changes, she's most likely going to get another breast cancer diagnosis, because she's headed in the wrong direction. So I'm now going to show you several before and after images that are really gonna show you what they look like initially when it's high risk, and what can be done and what the images look like after a woman has taken some proactive steps, which is what I promote. Because I not only take the images, but after reviewing the report and the risk assessment as a health coach, I'm counseling her about all the things that she can do to affect positive change. So this particular, when you look at that left image, she was definitely high risk. Do you see the asymmetry in the breast? You see more of the yellow and the red above the breast tissue. And you can see in the global breast, they don't really look alike. Well, in 5 months later, look what her breasts look like. You can clearly see the change that has occurred. As far as some of the things that she did, you know, I can't memorize everything everybody did from these images, but I do recall that she worked with someone that was more alternative in their outlook about health. And a lot of my clients who come to me are in this health and wellness community, searching for people who are trying to help the body heal as opposed to prescribing drugs and doing surgery. And I think we all know that there are people out there like this, and a growing number. I'm hopeful that there are still a growing number of these to come our way, of people who are going to work with us to help our bodies heal. So I know that she worked with someone on that. Most likely did lymphatic massage, because that usually is incorporated into every woman's routine after they come to see me and then go to see Effie and with her work. But if she had, let's say she had the Epstein-Barr virus, and I've had women, and this may be one, the next one is Epstein-Barr virus. I'll go to this so you can see also. The left image is a high-risk thermogram. You can see the asymmetry. This lady made an improvement in 3 months. And this is a woman who was identified as having the Epstein-Barr virus. I do not know if you know what that is, but if you had mononucleosis at any time in your life, you have the Epstein-Barr virus dormant inside you. And when the immune system is suppressed, the Epstein-Barr virus can come back and it can wreak havoc with your health. I do recall this particular lady had this situation. It came back. She worked with a healthcare provider. She was put on a strict diet. And basically, knowing that she had the Epstein-Barr virus, when she came to me with the thermograms, she knew that she had to work with this person and get that suppressed. And when she did, and it only took 3 months, look at what her breasts look like. You see the symmetry in her breast? So she reduced her risk that way. Here we go. This is showing what lymphatic massage does when a woman only does this. When I counsel women about what they can do, when they walk out of my door, they've got to choose what they're going to do. And some women do several things. If they're not on a healthy eating path, that's one of the first things I obviously counsel women to do, is get on a healthy eating path, because food is the foundation for this. But a woman can walk out the door and she may not change what she eats. She may not do any other things with her overall health systemically, because what we see in the breast images sometimes is reflective of overall systemic inflammation. So if you're not eating well, if you're not eating healthy, you're eating foods that cause inflammation, that obviously is going to show up in your breast health. It definitely will. And our food today in our environment is very toxic. And that's why we're every woman walking around is at average risk for breast cancer, just because of our world today with the food and our toxins in our environment. But this particular lady, she didn't do anything after she left, and she was a TH5 in the left breast. TH5 is the highest risk. You can see in that left breast that there's warmth, because you see the green and the yellow, and you don't see that in the right breast. So she didn't do anything for a while, and then she decided to go see Effie. And she worked with Effie only for 4 months, doing lymphatic work and the cupping. And she told me she did nothing else between this time that she did this thermogram, this first one, and then the second one. And In 4 months of seeing Effie, she reduced her risk by 1 point. She still has a ways to go, but you can see the dramatic improvement. And this is just one before and after of what we've seen when women make breast lymphatic massage and massage and things like the cupping that Effie probably explained to you in her presentation that she does. So here is, I want to show you these images in black and white. This is a before and after, and you can see how you're going to be able to see how subtle improvement can look in these black and white images. But this is also going to highlight one of the things that I definitely promote for women to start doing. I don't know if any of you have ever been in a sauna. A sauna obviously promotes perspiration, sweating, and perspiration is a detox, a major detox system in the body. We need to perspire. But far infrared sauna therapy means that you're not only getting the heat, it's still heat is being in the sauna, you're heating your body, but you're getting the advantages of the lights. And the lights at the far end of the invisible spectrum go to the cellular level to heal the body. This particular woman is an airline pilot. She has come to me from the very beginning. Because of the nature of her work, she is exposed to more toxins than most women. So she's always been above average risk. I asked her once if she would experiment with me with a therapy, this far infrared therapy, when she's in town for 1 week. And so I gave her a thermogram prior to this experiment. And then for 5 afternoons in a row, she used a far infrared therapy, not a sauna. It's a machine that one person here in Charlotte has that's like a far infrared sauna on steroids. It's called a Photon Genius. I don't know of anybody else in the country who has one. They cost $36,000. And it's in my client and my friend's home or parents' home in Waxhaw. And so I wanted to see what effect this would have on her thermogram. So for 5 afternoons in a row, she used this Photon Genius. And that's all she did. And she came back for a thermogram the next day. And in 1 week, she reduced her risk. I sent this thermogram to Dr. Wren, and in 1 week, she reduced her risk by 1 point. That's pretty significant. So you can only see in the black and white images, the grayscale, this subtle cooling. When you look at her thermovascularity, do you see all the loops and so forth and the patterns? That's not reflective of good breast health whenever you see this amount of thermovascularity. But what happened by using this far infrared therapy, if you look at this image on the right-hand side, you will see that those vessels have dimmed slightly. And in the color, it's also very subtle. This is the same woman. And I'm showing you the color images of before and after. And you can see it's also very subtle as well. But you can see that the image on the right-hand side of her front, overall, the colors are cooler. You can even see underneath the breast there where it was red. And obviously, and I didn't point this out early, and I want to make sure I do. When you see one of these images, the neck is always warm. That is always an area of heat when I take a thermal image. Underneath the armpits should always be warm. And underneath the breast tissue where the breast lay, they're always warm. So when I show these images, I like to clarify and tell women that when you see warmth in those areas, that is normal. But this is a subtle difference. Now, what this airline pilot does when she's in town, she uses that piece of equipment, I can tell you that. And she's bought a mini version of it. And if she doesn't have it with her, wherever she flies, she goes to the nearest wellness center and she uses a far infrared sauna. And Effie, in her townhome where she practices herself, she has a sauna, a far infrared sauna that I suggest if women don't want to do the photon. The photon is just more powerful. It's just like on steroids. And obviously it has a powerful effect on the body. There's a sound component to it, a light component, and obviously you're in a room, which it takes a whole room, and you're perspiring profusely, and you really feel cleansed once you do this therapy. I've done it myself, and it's, you can definitely tell, you feel good. Now, this is a lifestyle thing. I don't know if you know of anybody who wears Spanx. Well, if you do, you need to share this with them, because this lady that I imaged, this was her second thermogram, this image on the left, okay? And she had a good thermogram the first time. She came back to me in May of 2017 for her second thermogram, and her left breast went up in risk. Her right breast stayed basically the same as her first thermogram. And I said to her, what have you done differently in a year? And she says, Gay, the only thing I've done differently is I now wear Spanx every day. And she wore it right under her breast where the rib cage is every day. I said, please, please, please stop. And she did. And she came back a year later, and look at the improvement in the breast health. This is when I point out how structure is important for breast health. If this rib cage is restricted, and obviously wearing Spanx, that rib cage is restricted, and that's what happened to her. It negatively impacts lymphatic flow in the breast tissue. So if there's restriction here, even if you don't wear Spanx and you know that there's restriction in the rib cage, a lot of chiropractors know this, and Dr. Wren is an osteopath, and he definitely knows this. He's the one who taught me how important structural integrity is to breast health. Doing a technique that releases the rib cage can actually improve lymphatic flow in the breast. So whenever I see somebody who has structural imbalance, and I can sometimes tell by the way they hold themselves during the imaging. I ask people to put their arms up like this. And I can sometimes detect that there's structural imbalance. I immediately, when I discuss her thermogram with her, go to this and say, you know, this may be restricting your rib cage, which is negatively causing an area, particularly on the upper breast area. We can see heat sometimes strictly because there's a structural imbalance. And so Dr. Wren is able to correct this sometimes in one osteopathic manipulation. Many chiropractors can work with you on this, who get this, but it's very important that structure enters into every part of breast health. Okay, or every part of health, including breast health is what I meant to say. So this is when I'm going to talk about hormones. This is one thing with these grayscale images. We can definitely see in these grayscale images sometimes hormonal imbalance as well. And hormones and breast health kind of go together. And a lot of times what we're seeing in the images is hormonal imbalance. This particular woman I imaged in 2017, she came for her first thermogram, and notice the leopard-like appearance in this black and white image. She looks like a leopard, doesn't she? I mean, the spots. And so when I saw it, I went, whoa, what are you doing? I mean, are you taking anything? Are you eating anything that's estrogenic? You know, she says, well, I just started a new supplement and I don't know what's in it. So I said, go home and you call me and tell me what's in that supplement you're beginning to take. And it was a soy supplement. The first ingredient was soy. Soy is very controversial in breast health. Some people still promote it as beneficial because there's studies that show their benefits. And then there are other studies that show it's an increased risk by consuming soy. Well, it is a very strong phytoestrogen. Plants have estrogens in them. And soy is one of the strongest phytoestrogens. What that means is it mimics estrogen. And so she stopped. I said, please stop taking that supplement. And so she came back and 2 years later, well, maybe she actually came back in 2018. We saw some improvement, but then in 2019, we could really see that she had her hormones balanced. Because when I see any leopard-like or spotted look, then I zero in on hormones and let her know that's probably one of the things that she needs to address right away. But you can see the difference in the image. When you see light color, whiteness in the image, that's reflective of good breast health. When you see this darkness and particularly this spotted look, that's not healthy. So remember early on in my presentation, I showed you this image. It's on the right-hand side, the one that says organic TH1. That is the same image. So her first image was in August of 2016, her first thermogram. And she was a TH3 and a 2 in the breast, which is a very good risk rating. If a woman can be a TH3 average risk rating and be stable, and we don't see any changes, that is a good risk rating. And over time, we're going to establish a baseline of what she looks like. And then from there, if a woman can do this once a year and there are no changes and she's stable, then it can help her make decisions about other screenings, and it can let her know that she's doing the right things. It's only when women get off the path of their healthy path that they're on that changes can occur. And of course, I haven't even mentioned stress. And of course, you can't talk about health or any aspect of health without talking about stress. And how does stress show up in the images? You can rest assured it shows up in these images, because when I showed you that woman with hormonal imbalance, frequently I see that when a woman's not taking a soy supplement, she's just under extreme stress. Because what happens with the hormones when you're producing the cortisol and adrenaline, your progesterone levels are low. You're not producing the progesterone you need to balance it. And you're in this state of what we call estrogen dominance. And women don't need to be in a steady state of estrogen dominance. That is an increased risk for breast cancer. So in this particular, I kind of go back and forth. I want to get back to this to let you know what this woman with a good thermogram did when she came to image in August 2016. It was a good one, but what she did to affect this really positive change in March of 2018, what did she do? Well, remember I said food is the foundation for this, and it certainly is. She told me after the first thermogram, she says, Gay, I'm whole food, plant-based. Plant-based doesn't mean you don't eat any meat. It means the majority of your plate is full of plants. Okay. She says, that's the way I eat, but I'm not picky about eating organic. I said, okay. So in the time that elapsed, when I saw this image in March of 2018, I said, oh my gosh, what did you do? And she says, I am all organic now. So if you don't think food matters, this is the before and after images. These are the images I show to emphasize the importance of getting on a healthy eating path, to be in health, good health overall, and to affect good breast health. Because guess where, ladies? Toxins hang out, particularly after menopause, in the fat cells. So most women have some fat in their breast. And so you are actually after menopause producing estrogen in your fat cells. And yeah, that's not, yeah. And so that's why even gaining a little weight after menopause can be a factor and increase, it can increase your risk. Weight does enter into this, and the more fat that you have, the more toxins you're producing, your body's holding on to. So that's why the things like the lymphatic massage that Effie does. And also, I don't know if she mentioned a rebounder, using a rebounder, and or it's called a mini trampoline, if Effie mentioned it or not, but that also helps with overall lymphatics. And I have a desk chair. Jane has seen it. It's a bouncy ball. So I'm sitting right now on a bouncy ball with a base. And when I'm at my screen like this, too much during the day, too much, I don't like sitting here, but we all have to do this for work. I can bounce up and down. See, look what I do when I bounce up and down. I'm bouncing up and down and my breasts are moving. And I'm sure she addressed bra wearing, because if you are still wearing bras with wires, I am going to encourage you, it's not too late, to take those wires out of those bras. Do not wear a bra with wires every day. You may reserve it for that special occasion when you need a lift. Other than that, I see heat more related to the wires in the lateral breast than any place else when I image a woman. So women come here, and if they are still wearing bras with wires, they immediately go and take them out, or they get fitted for another bra without wires that they can wear on a daily basis. You don't want anything restricting you. Effie may have mentioned also about deodorants. Obviously, antiperspirants, no. The aluminum and the toxins in deodorant and antiperspirants, no. Because if you're wearing antiperspirants and not perspiring, guess where those toxins are going? Right into your breast tissue. So when I say that these are simple lifestyle changes that women can make. And when these are all added together, this is when change occurs. And I've seen enough women come up with their own plan. Usually it includes not wearing a bra with wires every day, doing lymphatic work, balance their hormones. Obviously, if they're not on a healthy eating path, I encourage them to try to do that first. And there's certain foods that I counsel them to eat that actually help you metabolize your estrogens. And these are foods that most, cruciferous vegetables, I'll just mention those because they're at the top of my list. If you eat things in the cabbage family, I don't know if you like broccoli, cauliflower, Brussels, those are all so very good for us. So I really recommend that women double up on those as much as they can, if they can, consume them without having any other issues with those foods. And because they are protective, they actually have indoles that help you metabolize your estrogens. What we don't want to do is have poor gut health. And that's, Effie says the lymphatic system is the immune system. Well, it's part of the immune system. The gut, the digestive system is extremely important to detox from all these toxins that we're exposed to, but also for metabolizing our estrogens. Because if you have too much of a certain enzyme, that when the liver does its work in metabolizing the estrogens, instead of the estrogens, the excess estrogen leaving the body after the liver has done its work, if you have too much of a certain enzyme, they will the estrogens recirculate in the body. And that's when you hear women who have estrogen positive cancers, that's what that means, is it's related to estrogen. That's why hormones are so very important, and not being in that steady state of estrogen dominance, keeping your stress levels managed as well as you can in a world that's very stressful. We can't always reduce stress, but we can learn how to manage it better. And that's so very important for hormonal imbalance as well. So what does this mean? Physiological changes occur years before structural change. That's pretty much what I said early on in the presentation. It takes 8 to 10 years for a lump to form in a breast. We're trying to get to women before that lump forms by encouraging her to make these lifestyle changes, get healthier, resulting in better breast health. So this image to the left here, you can see in the left breast. How many times have I said during this presentation it's the left breast? Quite a bit, because it is usually the left breast, ladies. I do not know exactly why. I think it's a combination of reasons. The left is where the heart is. And I am a holistic practitioner, and I know it's mind, body, spirit to create good health. And I do know that because the heart is here, and women in general, we are nurturers, and we over nurture others to our detriment, meaning we don't self-nurture as much as we need to. And I believe that has a lot to do with the left breast. But if you were to ask an oncologist or someone else in conventional breast care, where most cancers show up in the breast, they will tell you the left upper quadrant. And that's just a fact. I found that out. But this lady had a normal mammogram and a high-risk thermogram. And she was later diagnosed with breast cancer, probably by an ultrasound and then a biopsy. A biopsy is the only way to definitely confirm breast cancer, and that involves a needle. For women who come to me and they don't want to go that route, there are some marker tests that Dr. Wren uses and other practitioners like him to give a woman another part of the picture if she's concerned if she has breast cancer, to let her know what the level of abnormal cells are in her body, and that gives a practitioner, along with the thermogram, a good overall view of what's going on with her. Some women decide to go that route. Some women, when they have a high-risk thermogram, might immediately go and get a mammogram, which is fine. And if she has fatty breast and not dense breast tissue, that mammogram is going to pick up that centimeter-sized lump and from there, and an ultrasound can pick up fluid-filled cysts versus one more solid. They each have different roles, and I'm going to go back to that after, because I'm talking about this now. Go back to that slide before. These are all the technologies available: the thermogram, the mammogram, the MRI, the ultrasound, and this tomosynthesis is best known as 3D mammography, which is what most women have nowadays. It was approved by the FDA in 2011, and it came about because 50% of all women have extremely dense breast tissue. What does that mean? It doesn't mean you can feel density. The only way to actually determine what your density is to have a mammogram. That's the only way you can definitively know if you have dense tissue, because in dense tissue, they can't see what they're looking for. The X-ray shows up white, and what they're looking for is white, like this. This is fatty tissue, and you see that area in the breast shows up very clearly. Well, look at a woman with dense breast tissue. That's like finding a needle in a haystack. So mammography is not effective for women with extremely dense breast tissue. A woman with dense breast tissue, and they follow a visual, 4 visuals. These radiologists look at, these are the low density, these 2 images, and these are and they rate it. And they have to tell you on your mammogram report what your density is. It's a law in most states nowadays. So, so I just guide women as to, if they want to do another screening after they have a thermogram, whether it's a low risk or medium risk or high risk, they still want another screening. I guide them for the right screening for them. And let's face it, women, mammography is a very controversial screening. It has been for years now. And there's a country in Europe, Switzerland. The medical board does not recommend routine mammography for their female population because they say this: the risk outweigh the benefits. That's one country that does this. Now, that's pretty extreme. I'm not saying that no woman in Switzerland gets a mammogram, but it's not recommended at age 40 that she start getting them and have them up to 60 or whatever, or 70. That's not recommended by their medical board. Now in our country, it is the gold standard. And all the organizations that make the guidelines for mammography disagree about when a woman should start and how often she should have them and when she should stop them. They all disagree. 40 seems to still be the magical age when I think most women are approached by their healthcare provider to say it's time for your mammogram. Women just need to make their own choices about it's not one mammogram that hurts a woman, but it's cumulative radiation over the years that actually increase a woman's risk for getting the very disease that mammography is trying to pick up. So an ultrasound, many women who have a specific area of concern, they come to me and there's heat there. They'll decide they want an ultrasound because they're not getting the radiation. Well, you cannot get an ultrasound without having a mammogram through a doctor here or any place in this country. The only way to do it is go outside of the system. And there is an organization that comes to Charlotte regularly called HerScan. And I recommend that women who want to do the ultrasound instead of a mammogram go that route, just to confirm that the heat that we show that's in an area where she feels something, or if she and Effie pick up something and she's concerned and she can't sleep at night, of course, I understand that, we understand that, then the ultrasound will be a good way to let her know, give her the peace of mind that that's a fluid-filled cyst and not something that needs further investigation. These are tough decisions, but women have to think, all women should think about what's right for them. So I want to one other thing I wanted to show you, and This is not my camera. I hope I never see this because this is very, very disturbing. There's a rise in the incidence of inflammatory breast disease in younger women. I'm talking the 29 to 39-year-olds, and it does not show up as a lump. It normally shows up as a rash. And the women who are not encouraged to have any screening are the women younger than 40. And the 20-year-olds don't get any screening, of course. And I and you probably have heard of women younger and younger being diagnosed with breast cancer. And I know Effie pointed out 1 in 8 women in her lifetime are affected by this disease. So no wonder there's fear around it. So this is what it shows up. Inflammatory breast disease looks like in a thermogram. And if women can come here before the rash is formed, because a rash is going to show is heat, it's going to show up hot. And so if there's any indicators of that, it would give her a heads up that there's something, you need to do something. Whereas most of the time this is diagnosed when it's a full rash and some other physical changes, but not a lump. And unfortunately, it's a very aggressive form of breast cancer. So what's involved with having a breast thermogram? Jane can tell you, you get a little chilly for about 20 minutes. Simple protocols I ask you to follow. Most of them are 4 hours prior. Some I ask you to refrain, like no chiropractic care, no massage therapy, those kinds of things heat the body. And I don't want you to do that, you know, close to the thermogram. So I send you these protocols to follow. And when you arrive, I further cool your body down. In the temperature control room, it's right around 60, it is 68 degrees. I keep it 68 degrees all the time. And for 15 minutes, you acclimate in this cool room. And then after the 15 minutes, it takes actually 5 minutes for me to take these images. I have a little rug that you do a little jig around the rug and it positions you for every image I take. And then after that, I send these images to a doctor who evaluates them because I am a coach. I'm a health coach. I'm not a chiropractor. I've not been trained to read x-rays. So I send this to someone that Dr. Wren has trained locally to read these for me and to give the final assessment. And then I usually get the report, usually a week, 7 to 10 days. But this is a picture of my thermography room. Obviously, you'll be undressed where I'm standing because you will be undressed from the waist up, and I'll be around at the camera taking the images. Who is it effective? All women can benefit from this, and all breast types, especially those with dense breast, as we now understand. Women with breast implants, because women who have breast implants getting mammography, what it's doing, breast implants don't last forever. Plastic surgeons may not tell women that, but they don't last forever. The more mammograms and the pressure you're putting on with the mammograms will actually weaken the implants and cause what that implant is made of to seep into the tissues. It's not a healthy thing. Obviously, women after they've had breast reductions, even women who've had cancer can monitor their breast health after cancer to get a baseline. And a lot of women who are affected by breast cancer decide after that experience, I'm going to do things differently. That's when I feel that most women make changes. So thermography would be appropriate for her because she doesn't want reoccurrence. It is safe for pregnant and breastfeeding women, although I do not promote it for those women because these women are very hormonal. And so hormones show up so much in pregnant and breastfeeding women. But if a pregnant or breastfeeding woman has something going on with her breast, she obviously shouldn't do a mammogram. She could do an ultrasound, but I have had a couple of women in those categories come here just to ease their mind that what they're feeling is not anything they need to be concerned about. Simple and painless, non-invasive, no radiation and compression, which is what draws a lot of women to thermography because there is no radiation and compression. And it is the only screening that provides a risk assessment to allow women to take a proactive preventive approach to this part of their health. So I have 2 appointment types available. The fully interpreted thermogram, I do 9 total images. A detailed report is generated, and the follow-up appointment with me as a health coach to go over it and discuss ways to improve breast health. So that's my pricing for that service. And just this past March, kind of bad timing, that I introduced something called a thermo glimpse. And I am mentioning this to you ladies because your daughters, if you have daughters, okay, or you know any woman that you think might need this, the younger they are, and the fact that this is not even in their radar, this could bring their attention to the fact that breasts need to be taken care of, and they don't have any other screenings. Like I said, the 20 to 30-year-olds are not recommended to have any kind of screening. So the thermal glimpse is designed to educate people about thermography and to give you a glimpse of your breast health. I take the same amount of images, and during the cool down, instead of staying in the thermography room and getting your breast health history, which is normally what I do, especially on the first thermogram, the woman during the cool down watches a video that I have put together that explains everything. She can watch it. I take the images. I put the images on a flash drive, because you got to be techie with the young people. So flash drive, she gets the images with a copy of a sample report and the video. So she can take it home, look at it again, look at what we're looking for, and decide if she wants to apply this thermoglimpse that she's had to a fully interpreted thermogram. I've made the price point very reasonable for women who might not be able to afford a fully interpreted thermogram, because I'm dedicated, before I stop doing this work, which is no time soon, there's so much to be done, to educating the younger women about this, so that they will, decide they want to do this, and because they'll be educated about it, and hopefully be incented to make some changes in the way they're living. So this is a lot, and I hope if you have any questions, now will be the time.
Thank you so much, Gay. Does anybody, like I said, I've just recently been through this. I got a very extensive, not only pictures, but also Gay went through everything with me and explained all the pictures, what every color meant. It was really, really informative to me to have just another sense of what's going on, of something that I can't see, and I back up to my callback, because it's not the first time I've been called back. I just have dense breasts, so they can't see stuff, but then I have to get radiated with extra radiation through the thermocentesis, which is a little concerning to me. So I just, those days, that week or 2 weeks between, it's nerve-wracking. And so I always want to know, what maybe aren't you seeing? So this kind of gave me a glimpse of things that I wanted to have a baseline for. So does anybody have any questions about the experience or for Gay? Okay. Well, it's like I said, it's something that I wasn't really that aware of for and it's not that it's new, as Gay said, but it's definitely another option out there that you can check in on. And it's nice to know that we do have control over these things. I'm a big believer in wellness and prevention. And so anything that we can do to catch before all of a sudden we have a problem where we're having to think about surgery or anything like that. It's
absolutely. We want to prevent women from having to go through all of this. And I don't know if Effie said this in her presentation, Jane, but this is a quote from Dr. Wren, who trained both of us. The hands-off approach to women's breast health is not working for them, meaning you have to be more aware of what's in that tissue to pick up. Most breast cancer is felt by the woman, not by the screenings. And they're relying so much on the screenings nowadays. But no, by taking charge of your breast health and knowing what's in the tissue and correlating with picking up anything in a thermogram is going to allow you to feel like you're in charge of this part of your health. So,
well, thank you so much, Gay. It was really
thank you. Thank you, ladies, for your attention. Take care. Bye-bye.
Next week, we will be back with our one of our library connections, and she's going to be going into Ancestry.com. So going into the holiday, I thought it might be fun for those of you who haven't really played around with Ancestry.com. This is an opportunity to kind of learn how that works and what you can do with it. And, you know, maybe you can do family party tricks, whether you're with your family or whether maybe you're joining them on Zoom. Maybe you can take some time and look into ancestry.com and maybe share it with your families over the holiday, either via Zoom or however you plan to get together for the holiday. So that's our plan for next week.
Sounds great.
Yay, thank you so much.
Thanks again, Jane, for having me, and thank you, ladies, for your attention to this. Take care. Bye.
One last share, next week, Monday, Wednesday, and Friday, the fitness center will be open for just seniors between 1:30 and now I'm thinking it's either 4 or 4:30. I'll have to double check, but just for seniors, and you'll have to wear your masks, but it'll be only for the senior group. So it'll be a limited number of people in there if you should want to come in. We still have our senior classes Monday, Wednesday, and Friday with Lisa, myself, and Julia, but now you'll be able to go into the fitness center as well. So good news. Hope to see y'all next week.
Bye. Thanks again. Have a good evening.
Thank
Bye.
you. Thanks,
Take
Jane.
care.
Bye. Take care.